Subject name Exercise Therapy 2, Department Physiotherapy Department. Today we gonna learn about open and closed kinematic chain exercises for shoulder rehabilitation. These are the contents. Introduction, open kinematic chains, closed kinematic chains, characteristics and shoulder rehabilitation. Introduction. The movement of one joint may require the motion over the proximal and distal joints, and sometimes it may not be required. There are two types of kinematic chains are present. One is open kinematic chain and the other one is closed kinematic chains. Now what is open kinematic chains? Open chain exercises involve motion in which the distal segment, means hand or foot, is free to move in a space without necessarily causing simultaneous motion at adjacent joints. Limb movement only occur distal to the moving joints. Muscle activation occur in the muscle that cross the moving joints. Open chain exercises also are typically performed in non-weight bearing positions. In addition, during resistance training, the exercise's load, means resistance, is applied to the moving distal segment. Now what is closed kinematic chains? Closed chain exercises involve motion in which the body moves on a distal segment that is fixed or stabilized on a support surface. Movement at one joint causes simultaneous motion at distal as well as the proximal joints in a relatively predictable manner. Closed chain exercises are primarily performed in weight-bearing positions. Example in the upper extremities included balance activation in quadruped, sitting press-ups, and wall push-ups. Now this is the picture. As per the picture, we can identify some examples of both open and closed kinematic chain exercises. We have two examples. One is elbow flexion and the other one is knee flexion. In picture number 1 or 3, we can see the example of closed chain kinematic exercises of elbow flexion and knee flexion. And the same elbow flexion and knee flexion in picture number 2 or 4 is example of open chain exercises. As this, we can identify that as per the requirement, for same movement we can use both the exercises open and close. Now characteristics of open and closed kinematic chain exercises. 1. Open chain kinematic exercises. Characteristics: increase joint compressive forces, increase joint congruency, means stability, decrease shear forces, decrease acceleration forces, stimulation of proprioceptors, large resistance forces, enhanced dynamic stability. The other one is open kinematic chain characteristics: increase acceleration forces, decrease resistance forces, increase resistance and rotational forces, increase deformation of joint and muscle mechanoreceptors, great shear forces, great movement forces, one joint in a motion. Isolation exercises use contraction of specific muscle or muscle group that produce single plane or occasionally multiplanar movement. Now rationale for use of open chain and closed chain exercises. The rationale for selecting open or closed chain exercises is based on a goal of individualized rehabilitation program. Because functional activities involve many combinations and considerable variation of open and closed chain motions, induce and integration of task-specific open chain and closed chain exercises into a rehabilitation. As the patient progresses, more aggressively strengthening can be introduced by moving from isometric and closed chain exercises to those that are more isotonic and open chain in nature. Now, general principles of shoulder rehabilitation. Many pathological conditions can affect the shoulder complex as with other part of the musculoskeletal system. This can be result of either acute trauma or repetitively microtrauma. Acute or chronic injury may result in a disruption of motion, strength, kinesthesia, or dynamic stability. As rehabilitation professionals, we can positively influence all of these components. Designing a rehabilitation program should take several factors into account. The degree and type of mechanical disruption first. Second is the chronicity of problem. Third is the strength and endurance of the rotator cuff and scapular musculature. Fourth is the flexibility of soft tissue around the shoulder, and the fifth is patient's anticipated level and type of activity. Now shoulder rehabilitation. Now muscle strengthening is depend on appropriate timing for initiation of muscle strengthening exercises during shoulder rehabilitation is completely depend on a diagnosis. Kinetic chain shoulder rehabilitation incorporate the proximal to distal motor activation pattern with proprioceptive neuromuscular facilitation. This approach focus on a movement pattern rather than a isolated muscle exercises. Pattern sequentially use the leg, trunk, and scapular musculature to activate weakened shoulder musculature, again active range of motion, and increase strength. It improves functional movement pattern of shoulder. The exercises are designed to stimulate weakened tissue by motion and force production in the adjacent kinetic link segment. For those who participate in either competitive or recreational overhead sporting activities, the most functional of all open chain exercises are plyometric exercises. Plyometric activities are defined by a strengthening shortening cycle of the muscle tendon unit. This is a component of almost all athlete activities. Now home exercises. Nothing is more important when rehabilitation the shoulder than remembering the musculature of the upper extremity and core. Total arm strengthening is a must when rehabilitation the shoulder because injury of the shoulder that limit normal functional movement pattern and use will result in a strength deficit of other upper extremity muscle overall conditioning including strengthening. Strengthening and endurance training of the other component of kinematic chain should be performed simultaneously with shoulder rehabilitation. Patient motivation is critical component of rehabilitation program. Without self-motivation, any treatment plan is designed to fail. For complete recovery, most rehabilitation protocol will require the patient to perform some of these exercises on his or her own at home. This requires not only the understanding of the maneuver but also the description for the patient to execute them on a regular basis. Now we have some examples of closed chain exercises for shoulder. Closed chain strengthening exercises of scapular stabilizers. Picture A, scapular protraction in closed chain manner, or picture B and C is scapular retraction in closed chain manner with balancing the body. Now open chain exercises for shoulder. Open chain strengthening exercises of the scapular stabilizer, protraction and retraction both, but in an open chain manner. Open chain strengthening exercises of scapular stabilizer with lightweight dumbbells means resistance training. For resistance training, we can use dumbbells, therabands, theratubes, etc. Open chain isotonic strengthening of rotator cuff internal rotation using theraband tubing, picture A. Lightweight dumbbell in picture B and the external rotator strengthening in picture C. This is show how we can use some apparatus for resistance training in progression stage. These are the reference: Clinical Orthopedic Rehabilitation, 3rd edition, and Therapeutic Exercises, Colby-Kishner, 6th edition. Thank you.